So, which basically means all our outcomes, basically all our activities are all geared towards our outcomes. So there's nothing that we're doing that is not, we're not going to be doing anything that's not meaningful or adding any value to our what our main agenda is. And then we also put personal agendas aside and drive and provide advice for the greater good of all adolescents and young people. So the gaps that we noticed as Maisha Youth that needed to be filled was the lack of representation. Am I okay? I'm not clear. The gaps. Am I clear? Okay. Okay. Uh, so I was talking about the gaps that Maisha Youth is looking into filling. The first is lack of representation and inclusivity of young of you. Oh, sorry, of youth groups in youth agendas, e.g., PWDs, and marginalized and vulnerable groups. So what this is that there's meaningful youth engagement. There's an issue with meaningful youth engagement. We're not able to work with the organizations that are coming together with agendas and policies to impact young people's lives. And so what Maisha Youth is looking towards doing is gaining representation in those meetings so that we're able to be part of the teams that are developing agendas that are going to influence young people. Secondly, we have the lack of comprehensive information packaged and delivered in a fun, innovative, and youth-friendly manner. Yes, the information is out there, but the information is not getting to the people that it's meant to get to. So there's policy documents and there's papers that have been written and there's information. Information is generally being put out, but then it's not reaching the young people. And then not because so I think the concern there was that the young people are not able to understand most of these policy documents and how they're written. And then so what we are looking towards doing is putting together this same information, but in a way that is palatable to the young person and making it feel like it's their own and giving them ownership of the documents. That way they're able to work towards implementing it. It's like their rights, they're aware of them, and the information is clear to them. Thirdly, there's the lack of a movement that brings diverse youth-serving organizations to champion for HIV and SRHR agenda. The youth-serving organizations are there, and most of the time it's that they're working separately. So what Maisha Youth is looking towards doing is bringing all of them together, which, if I could put it in my words, is to just have a representation of all these youth-serving organizations under one umbrella, if I could, where we're not working. If we're all working towards the same goal, we can all work together. Lastly, there's very minimal advocacy for the greater male engagement and involvement in taking action against issues facing young girls and women in the country. So for this, the young women and girls are being empowered, and every day they're learning what they should be doing or how their lives should be working out and how their rights work for them. And it's important that the male community is also aware of this, and that way it becomes more of a community issue than just the women being pushed, the women issues being pushed. That way, the men are also more involved and they're able to be more aware. So this is how we go about our projects or our programs. So we inform and equip adolescents and young people with skills, opportunities, and knowledge to foster their holistic sexual reproductive health, or just about so it's about building the person. The person becomes holistic in the sense that you have more than just more than your health in order, more than your books in order, more than your career in order, so that everything works in cohesion. We also facilitate adolescent national and international decision-making processes and an intergenerational partnership. This is exactly what I was talking about with meaningful youth engagement, whereby so we are bringing young people to the table to sit with the older generation, where they can be able to discuss things and then be part of the change that is going on in their country. Thirdly, we continue to advocate for young people and amplify their voice in the county, international forums, and as well as national. Again, meaningful youth engagement. That's what Maisha Youth is trying to do. We are trying to sort of redefine what meaningful youth engagement is, because the question that's been asked is how do we engage the young people, and that's the question we are trying to answer as a movement. Support collaboration among diverse youth-serving organizations and entities, as I have explained before. So the diverse youth-serving organizations, there are many. There are a lot of organizations that are coming up with projects and programs to work for the young people. And so I feel that as Maisha Youth, this is something that we are very passionate about, being able to collaborate with different young people organizations, youth-led. And so it's important for us to foster those relationships and build on them. That way we are able to reach our goals. 2017 was a good year for Maisha Youth. The birth of Maisha Youth was right after the Maisha Youth pre-conference, which was supported by the National AIDS Control Council. It's a biennial conference that's held every 2 years. That's what biennial means. And so this last year, we had the opportunity to be part of the team that planned the conference, and we were able to organize the very first Maisha Youth pre-conference that was able to reach almost 1,000 people. We brought in almost 1,000 young people into the Hilton Hotel in Nairobi, and it was a very successful event. And after that, we were able to now sort of solidify Maisha Youth, because it was sort of very clear for us that we could do more with the space that we have been given. And then right after the Maisha Youth pre-conference, we were fortunate enough to work with the Ministry of Health in planning the Adolescent Health Symposium, which we were able to have about 700 people coming in for the meeting. And then online, we had a presence of over 700,000 reactions, reacting to our posts and whatnot. And it was a very interesting meeting. And then right after that, we had the opportunity to plan the World AIDS Day 2017, which I must say was a great success, also supported by the National AIDS Control Council. And the most recent project we had was Maisha Youth on the Road, which was for us our very first project that we sort of had complete ownership of. Like we planned that we had the idea and we should reach out, and so we planned it on our own. And this was a very enriching experience, in my opinion. We were able to reach 4,500 young people on the ground with information, and we were able to give out the frequently asked questions booklets, and it was a very interesting time that we had this one when we went to Kilifi County, we were in Mombasa, and we were in Kwale as well. And I think it was a success. And we were online, we were able to have up to 1 million reactions, and I think that's where my presentation ends. Rasheed will continue from there, and then we will take questions in the end. Rasheed.
Thank you very much, Becky. So really after this, we just want to continue on expounding on Maisha Youth on the activity that we were able to completely run with, and it was quite a great thing. It was quite a great experience for us. So we'd like to just highlight how the event went and some of the things we learned from the on the ground engagement, and then now we move on to the next activities that we want to do for 2018. Yeah, so Maisha Youth on the Road. This was a project, a 4-day road trip that covered Kwale, Kilifi, and Mombasa counties, sponsored by NAC, G-Activate, and AHF. And it also marked the launch of the Maisha Youth Movement website on the 31st. The goal of the project the overall objective was to really just reach out to adolescents and the overall objective of the project was to reach out to adolescents and young people with comprehensive information, packaged and delivered in a fun and innovative way. while also trying to facilitate an intergenerational dialogue in the different town stops to get realistic views and opinions of young people. What we were really something that we were very keen on was not going on the ground and saying that just coming with our own perception of what it is that young people are facing, but being able to engage or to actually facilitate that dialogue between us, Maisha Youth Movement, and the young people on the ground, and just get the realistic opinions, the realistic views, especially around HIV prevention and uptake of SRH services. So some of our indicators of achievement were: one, our hope was to distribute around 10,000 condoms. Then secondly, we wanted to reach out to 3,000 young people with one-on-one information, knowledge, and skills. And then finally, we were hoping to test 2,000. Now, over the course of the time in Kwale, Kilifi, and Mombasa counties, there are some overarching issues that we noticed that we'd like to highlight. First of all, was the aspect of religion and culture. And what you have to be cognizant of that in Coast, there's almost a very thin line between the religion and culture and the religion culture. Religion, and more specifically the Islamic religion, has actually influenced the culture of people. So some of the things that people would say are not part of their culture was actually based on their religion, and some was not part of their religion, was based on their culture. So this was really a big barrier in terms of uptaking services, and even uptaking when we were having the conversation on contraceptives. I mean, at some point we were trying to distribute condoms to young women and some older women, and they'd actually be very receptive towards it, because they'd be like, oh no, I can't take this condom, you know, it's not allowed in my religion, it's not allowed in my culture, what will people think of me? So that was something that we did sort of overlook, but it came up. Secondly was there's little to no sensitization on the use of condoms for family planning and HIV prevention. And this is really, it just shows that, especially in these counties, there's huge myths and misconceptions that are marred around contraceptives, especially condoms. The moment you're trying to give somebody condoms, they already have a perception or who are supposed to use condoms. They tell you, oh, you know, this is not for me, I'm married, or this is not for me, my husband will take it well, or there's just a huge myth, or there's a huge conversation around condoms that is leading people not to uptake and use condoms. Then thirdly, the packaging of the free condoms was termed as too obvious and hence directly affected the uptake. We were utilizing the AHF lab condoms, which were absolutely amazing. I mean, for some of the people who'd look at them and see they're not sure, they would take. But what we noticed is the AHF packaging and the packaging from NAC, the Sure one, both of them are red. So people would see that it's a red thing and say, that's condoms, I don't want condoms. I don't want condoms. So it was really a challenge trying to distribute these condoms, especially during the day. Then moving on, we had people, something that we noticed is people had information on where to get access to HIV testing services. Because one of our bigger questions that we were trying to ask was, in this specific county, in this specific area, where is it that you could get HIV? And we noticed among people, everybody knew you can go to this facility, to that facility, it's free, you know, they even knew the procedure of getting the testing. So then it brings in the bigger question. If people already know how to access the services, then what is happening in between that people are not actually accessing the services? Then, and this, the next point we actually noticed it in Kilifi and Mutaha, is that people were very responsive when we used the region's artists. Because on the second day, we adopted, or we went on the road with two artists. One of them was, I think, Dazzler, and another one called Susumila, who are very big in the coastal region. And they were able to galvanize a crowd. I mean, and they were able to also give the information that we were trying to pass on. And people were very, they accepted that. People were having so much fun when the artists themselves were distributing the condoms and talking about condom use. we saw people actually listening and contributing to the conversation. And then something we did notice in Trafa is that really there's a need to have persons with disabilities and those who are differently abled involved in all these projects, in to capacity build them, to be able to communicate, and also the information dissemination bit. And as I know, as I've just mentioned, we noticed this in Trafa. We did moonlight condom distribution in Trafa, and at some point there was this lady, and she was deaf, and she was trying to communicate with a lot of us, but unfortunately we couldn't communicate because we don't know sign language. But one member of our team was able to actually just have the conversation, and she was saying how she's had a lot of talk about HIV and AIDS, especially in Twapa, but she hasn't had information given to her in a way that she can actually relate to it, which is in sign language. So that's something that we noticed. Moving on. Talking about even hashtag Youth na Plan, we officially launched Maisha Youth. Oh, I've just moved on to the achievements. Sorry. So some of the achievements was one, the launch of Maisha Youth on the 31st at Pirates Public Beach in Mombasa. And we did this in this area because we knew this was especially a very important day if we wanted to reach our target audience, which is adolescents and young people. And when we were on the ground, we were able to interact. After launching the website, we had a bit of interaction, mingling with the crowd, talking to them about Maisha Youth and what we're trying to achieve, and just getting the opinions on some of the things we ought to align ourselves to, and also distributing condoms. And it was an integral part of the whole entire road trip, especially having it at Pirates. We noticed that there's something that we're missing. We're missing out on a huge chunk of people. I mean, later on, even in the evening, as it was getting later, but the place was only getting fuller. That's what you mean. It was getting fuller. So you'd think that as it gets late, people would leave, but that was the opposite. As it was getting late, more people were coming in and streaming in. So even in-house, we noticed that probably come 2018, 31st December, we might want to have now a huge activation at Pirates Beach because there's a huge chunk of people that we're missing over there. Yeah. Moving on to the next slide. Some of our achievements, again, as I was saying, first of all, we were able to distribute 18,000 condoms when our target was 10,000, meaning we had 180% condom distribution achievement. And just to pick up on that, where we were able to really distribute the condoms much was in Mutaha and at Pirates Beach. And it's because we did this in the evening. So we'd have even people coming and saying, no, I can't have like 4 or 5, give me a whole box, give me 10, give me 15. So the aspect of distributing these condoms in the evening actually really increased the uptake of condoms. Moving on to the next slide. Then secondly, we had 150% reach in terms of people with information dissemination and just conversations. Our target was for 1,500, but we were able to reach 4,500 with the one-to-one information. Now, before I continue on this slide, just something to note is we were not able to do the testing during the whole road trip in Kilifi, Kwale, and Mombasa. And this is because we had a hard time trying to get service providers who had opened shop at the time. So this slide is really, this is just the face of this is the face of our website, the Maisha Youth website. You can get it on www.maishayouth.org, and I'm just going to type that in for anybody who wishes to log in and see some of the activities that we've done, and also register to become a member of the movement. It is there, www.maishayouth.org. We have been driving traffic for people to join the movement, and at the moment I think we are on 300 plus, and yeah, it's the movement really is growing, and for this year we want to galvanize that and move it to almost 10,000 young people engaging on our website, and we're continuing to refine the website to have it be as interactive as possible with our audience. Moving on to the next slide. So now the question is, what is it that we have sort of planned for 2018? I mean, 2017 was a very good year. We had quite some interesting activities and engagements and activations all over the country. And so now we had quite a challenge trying to think about 2018, but we're just going to share where we are at the moment. Moving on. So for 2018, first of all, it's just the four important questions: who, what, how, and where. Dr. Motate, you can lie about your age. Anyway, so first of all, our audience continues to be young people aged 10 to 29. And as Becky was mentioning earlier on, when we did the Adolescent Health Symposium, I think even for our team, it was just a new aspect for us because we had to actually program and do activities for 10 to 14-year-olds. That was the first time we'd done it, and it was a success. And moving on, we actually want to continue doing this because a lot of the things we do are targeted towards youth, and I say youth between the ages of 16 to around 27, 28. So that continues to be the people we're targeting this year, and moving back to all the way to 10 years old to 29-year-olds. Then what? The what is what it is, what are the topics, what are the conversations we want to have. First of all, it's around, our bigger conversation is on HIV and AIDS, and we have a lean and bias towards HIV prevention. Then secondly, we want to talk about sexual reproductive health rights for adolescents and young people, and we're leading that dialogue on SRH, especially with one activity or program that we'll be doing this year, and I'll explain that later on. Then thirdly, we want to also talk about drug and substance abuse, because what we notice is the first drug and substance abuse and SRH and HIV, there's sort of an interlink towards all that. So it's all the conversations complement each other. Then fourthly, we want to really delve into the aspect of mental health, because I believe, or we believe, that mental health has been missed out for a while, and it's important to now start having that conversation. Mental health for young people is a big issue. It's a challenge on our end, but we believe it's a challenge we can actually be able to tackle and achieve and get to our end goals. Then the where about what we're doing is, as Becky mentioned, online, because we do ourselves as a virtual movement. So we're really going to be having a lot of this engagement online. At the moment, we're doing it on our social media platforms. That's on Facebook, Twitter, and Instagram, but our audience is mainly concentrated on Facebook. That's why we're able to have some meaningful conversations and engagement. But we also want to move that further and have YouTube and blog posts and our website actually being interactive, and maybe even podcasts. Then the other where that we want is offline. And by offline, I mean we want to continue to participate in organized social events, festivals, and conferences. And I can just mention that on the 13th of February, we will be doing the International Condom Day, which will happen in Nakuru. In partnership with the National AIDS Control Council, we are planning that. Then also we want to do a lot of, or engage in school events, and for this we wanted to target like the drama festivals that are happening in this term, and then music festivals that happen in second term, and also just looking into any possible avenue that we may have to get to young people who are in school. Then thirdly is really on the technical working groups. We want to see how we can actually have, we already do have some seats in the national CWGs, but we're trying to now devolve and grow our network and have young people that we've engaged in Kisumu, in Mombasa, Kilifi, Kwale, actually part of their county TWGs, and giving feedback on what's happening on the ground to us, so that we can feed it to our social media platforms and then have that interaction happening two-way. And then thirdly is we want to participate in relevant international days. As I mentioned, First of all, it's the International Condoms Day. We can do World AIDS Day. Any relevant international commemoration, we'd really love to continue participating in those and engaging young people in that. Then the how bit is it's really just to get young people to understand the policies. As Rebecca mentioned, it's getting all these policies that are out there and actually making them palatable to young people. Palatable is already a big word, so I think the first step would actually to get another word other than palatable, but really just get policies and put them in like a small infographic. Just the big main things that they need to know on the policies that affect them. And continue again events, the global and the national events. We have a really big lean towards innovation, and even in-house, one of our big innovations that we're working on at the moment is an application, and I'll get to talk about later on. And then just opportunities that young people can have. And we continue to work on emerging trends, online campaigns, and using new media such as infographics, animation, illustrations, and video clips. Moving on to the next slide. So our targets for the year, as Becky mentioned last year, from all our engagements and activities, we're able to reach quite a huge number, both on the ground and online. So the number one is really just in total, the number of young people we want to reach with information is to the tune of 15 million. I think last year we were able to do almost 7.4 million. And we didn't include that in the slide, but we'll be able, as we share this slide, we'll add that, just highlighting from all the activities, how many we reached on the ground and how many interactions and clicks we had on social media platforms that gave us the number 7.4M. So for this year, we actually want to move on to 15 million young people. Then secondly is on the one-to-one engagement and interaction, we want to actually engage 100,000 young people. And hopefully this can be reflective on the number of people who have joined our movement on the website or are following us on our social media pages. So it's an engagement and also pushing them to our platforms to continue the engagement. Thirdly, we want to increase the number of online platforms that we have. Currently, as I mentioned, we're working with 4. That's the Facebook, Twitter, Instagram, and the website. And we want to actually increase that to 8. We want to include a blog posts. We want to have a wider YouTube reach. We want to continue having that on the podcasts. And yeah. Then fourthly, we want to increase the number of followers on our social media platforms from 1,000, which is the number we have at the moment, to around 10,000. And as I mentioned, this fourth point and the second point hopefully could be a reflection of each other. That when we interact with young people, we also have them joining us on our social media platforms to continue the engagement. Because for us, the movement really has to live online. Moving on to the next slide. So the question becomes, how do we intend to do this? What we put in this slide is just some of the few activities that we have identified, or that we have identified for this year, and that will help us in reaching our number. There are still a bunch more, but this is just some of the few, and I'll give a small brief on each. For the first one on the right hand of the screen, the Maisha Youth on the Road Campus Edition, we want to do the road trip again, but this time we want to target campuses. More specifically, we want to do from Nairobi to Nakuru, through to Eldoret, and then Kisumu, and going to all those the campuses that we may get on the road on our way that way. Starting in Nairobi, maybe do a big activation at the University of Nairobi and invite other campuses there. Then if we go to Nakuru, we just pick one campus that we're going to, and then we invite other universities to come through and have that engagement. Secondly, the other activity is the Maisha Mtaani. Maisha Mtaani is one of the projects or thinkings that we came up with. In one of the TWGs or one of the meetings that we were in, there was a bigger question. And the question was, how do we engage youth-serving youth organizations, youth-led organizations in communities and in counties? And one thing that we really appreciate is that young people are not the same. Youth from the counties are not the same. What young people in Nairobi are facing is not what it's most certainly cannot be exactly reflective in Kisumu or in Siaya or Homa Bay or Mombasa. So we came up with this idea called Maisha Mtaani. And Maisha Mtaani would really be us going onto the ground. Say, for instance, today we've gone to Kisumu. Then we're able to just invite, just have a picture of all the youth-led organizations that are working in that specific area and invite them into a rapid design challenge where we'd engage them for like 2-3 days. And by the end of that meeting, we come up with a framework or a roadmap for any entity, any organization, if they want to come and do a program or a project that is targeting young people, then these are the steps to be taken to really achieve that. We will be doing something like this with Deactivate, and I'll talk about that in a minute. Then, thirdly, we have the HIV Prevention Festival. This is just one thing that we want to plan in-house. We had planned for it last year, but we were not able to do it. But we will probably be able to do it this year around August. And it's just it's an activation where we're able to invite young people, speak about HIV prevention, speak about the new innovations in in HIV, talking about self-testing, talking about PrEP, female condoms, talking about the conversation on contraceptives, and but it's a musical, it's a sort of musical festival, so it's really fun and learning at the same time. Then we also want to have a YouTube campaign, and our YouTube campaign is it's not really like a campaign that's sponsored or whatnot. It's just something that we're working on in-house, doing a couple of videos from us and also from our audience talking about just having conversations with young people about things that young people are facing. We want to talk about sex, we want to talk about condoms, we want to talk about the reality of condom use in campuses, we want to talk about drugs, the impact of alcohol and sex, impact of alcohol and whatnot. It's really something, it's an awesome engagement that we are working on, and we will be happy to invite everyone the moment we start on it. I will be happy to invite everyone to contribute, give us comments, and on how best we can improve it. Moving on to the next slide. So really, for on everything that I've just said, on every activity, the thing is that every single thing that we do has to just come down and feed into this funnel. Like any independent activity that we're doing, just comes and feeds into the funnel of the Maisha Youth targets. That is the roadmap that we have for 2018, and we're hoping at the end of this year we may be able to sit down and say, this is what we did. Now let's come up with a 2-year, 3-year, 5-year strategic plan. We're actually already planning on it at the moment, and we'll be able to share that once we have done so. So, truth is, there are some of the questions that we actually need to answer as we move on. First of all, it's when we say that we will do or we were able to reach 1,500 or 4,500 young people with information, the bigger question becomes, what is the minimum package to say that someone has received information? And then secondly, is it an information package that also serves as a referral package? And for us, our drive is really, we want that in anything and in everything, we have come up with an information package or just a one-pager on some of the information that the things that we'll be giving to people. Like if I'm engaging you for 5-10 minutes, what are the 10 things that I'd have loved to told you in those 5 minutes? And we really have a huge drive towards linking people to services. I think this is one of the bigger things that we want to do this year. Is we want in any engagement that we have, it has a direct proportion to the uptake of services. So it's saying we're doing 1, 2, 3 things here, or we're telling you about, today we're talking about SRH or GBV, we were linking you to the services that actually do that. And it becomes a bigger challenge for us because we probably have to start mapping out in all these counties service delivery points for young people that are youth friendly. Then another question is, as we mentioned, we really want to leverage on existing youth serving entities. And for us, we do not intend to work in soliloquy, but we really want to collaborate for better reach. Because I believe that's the way to go now. It's collaboration, collaboration, collaboration. There are a lot of youth serving organizations on the ground doing a lot of things. But even in a conversation that we had with the Ministry of Youth, is they mentioned that the bigger challenge is there's no collaboration. There's everybody's doing things in pockets, pockets, pockets. So you want to be able to try and have that collaborative bit in terms of all the youth-led organizations working for young people, especially on SRH. And then finally is really a bigger question is what are the suggestions for engaging and targeting rural youth? We are still open to listening into what people believe should be the roadmap to targeting the young people who are in the rural settings, because for majority of the steering committee of Maisha Youth, it's young people who are from Nairobi. So we may not be able to actually program for youth who are in the rural, yet they are the majority population. So we are asking, what are some of the suggestions or what are some of the ways that we can actually be able to engage young people who are living in the rural areas? Ladies and gentlemen, that is the end of our presentation. Thank you very much for logging in. I've seen some questions. I'll probably ask Becky to take 1, 2 questions and then I can take the other. So over to you, Becky.
Okay. Thanks, Rasheed. I hope. So I'll take the question that's been asked by Tobias. How do we intend to engage youth-led organizations within the community level so they can empower fellow youth? I think the answer to this question is with regards to the project that we are currently planning to roll out, which is the Maisha Mtaani. And the way Maisha Mtaani is designed is in such a way that it's not a one-stop kind of what Maisha Youth on the Road was, because Maisha Youth on the Road was we sort of just drive through. But Maisha Mtaani is designed in such a way that we actually go down to the ground and we meet with different youth entities and their leaders, and then we're able to discuss with them using the design that Rasheed just explained, the Rapid Design Challenge, where we actually talk about the issues that are going on in their communities and what they feel should be done to sort of resolve the concerns that they have. So I think that's the best way currently that we are looking into engaging the young people at the community level. And so we will be going to different counties and different towns. And I think we could probably share the plan for that. And then so that way, different people, everyone is sort of in the loop on what is going on. And then when we come to your town, it's easier for people to reach us or for us to reach them. And then also, if you know of any interested youth-led organizations, we have our contact, which I think Rasheed will put in the comment section, so they can be able to reach out to us in case for any working partnerships. Then, okay, then Evelyn also asked something almost similar, which is how we plan on how do we, okay, yeah, this is where you have a fantastic strategy. Thank you, Evelyn. We do have a huge population of young people out of schools and at high risk of infection, drug use, etc. These and there are plans to engage this important population, especially in the informal settlement. So I think the same project that we're doing, Maisha Mtaani, also applies, where we will be going to the ground, the actual ground, and speaking to people who are going through this. That way they're able to express what it is they're going on. Because, you know, again, the dynamics are different. Where we sit, we might not know what really goes on in the informal settlements. We may have an idea of what goes on in the informal settlements, but it's definitely not very as clear to us as it is to them. And that's where, so with everything that we're doing, we first reach out to the people who are actually going through these things. And then that way they're able to tell us how we can help and sort of come up with ideas that work for them as well. But then we're open to also suggestions and, you know, telling us what you think we should also be doing to reach to this population? Yeah. Rashid, you should probably take the other questions.
Thank you, Becky. So, Felix, you have the question on the most at-risk adolescents. Thank you very much for that question. And really, truth is, this is also a very big audience that we're trying to map out. In-house, we have the community engagement and advocacy team, and they have been working tirelessly to actually define some of our different audiences that we will be targeting in this year, and also trying to see in the activities that we've highlighted who are those that will actually reach and who are those that will have to find a new way of reaching with our activities. And one of those that came out is really the MARA, the most at-risk adolescents. And I see you're asking if this includes adolescents who report same-sex or sex work and are sexual, yeah, the correct term is sexually exploited, and those who are injecting drugs. The answer to that is yes, yes, and yes. I think it's about time that we actually start having this conversation about adolescents and young people, especially adolescents who are reporting same sex, because it happens especially in boarding schools. If you went to boarding school like I did in the parts that are not in Nairobi, you actually can get some of these stories. And truth be told, the other day there was an engagement we were having with Ishta MSM, and I met somebody who was actually in high school with me, and I was like, okay, so this thing is actually happening. So it's a conversation that we need to build up on, especially on the adolescents who are reporting same-sex, and then adolescents who are injecting drugs, especially in the coastal parts of Kenya and even in Nairobi. And for the conversation that we're talking about on drug and substance abuse, the challenge is Malcolm, who I see is continually commenting, can actually just comment in the chat and talk about in his engagement that he had in Isiolo, he found out about a new drug that was called Keter, and it has the similar effects probably of crack cocaine, and it's administered like heroin. New things. The other day I was reading in the newspaper about something that's called codeine, and codeine has been a drug that's abused for the longest time abroad, and now it has become a trend here in Kenya. And it's very easy to get codeine because it's made up of cough syrup and painkillers and a soft drink. So the conversation on adolescence and the use of drugs is ever shifting, and we recognize that even as the team, we have to continually try to shift that to adopt the shifting conversations, but also to work with partners that are already on the ground and they already have that experience working with young people on that aspect. For us, really just bring in the youth voice, and we try to bring in to put the young person at the center of it all. But we learn from that. It's sort of like an adult young person ally, like it's an intergenerational dialogue, so that we may be able to target these young people and be able to reach them with projects and activities and activations that are relevant and speak to them. So that continues to be something that, as we continue defining, we're taking these first 2 months to really just define the scope of work of Maisha Youth, our communities, our activities, are they aligning to the communities, so that we, by the time we're rolling out again on the ground, we really don't miss out on any integral bit or any audience. And I guess that actually ties in to the question that was coming down here about how are we planning to engage the very rural urban areas of young people. Again, as I mentioned, we're really just at the moment we are targeting, or we are highlighting our audiences, and we're segmenting into the different. We have the urban youth, the rural urban youth, we have the rural youth, the very rural youth, we have the Muslims, we have the youth adolescents who are having the adolescents and youth who are engaged in same sex. We are defining our audience, we're segregating them, as many possible segregations as we may have, and then now seeing if any of our activities align or speak or actually is something that they can own up to, or do we need to come up with something new that can target these young people. So that continues to be something that in-house we're working on, and we'll be able to roll it out probably by the end of February or beginning of March, when we have now a partners roundtable where we now have defined structures and activities and a clear budget line of what we want to do. Then there was a question on if we have tied our activities to tangible outcomes, and how we measure that overall in terms of contributing to reduction of new infections and messages leading to behavior change. So as I mentioned, we continue to really define the activities and everything that we want to do for this year. And one of those things is if from what I said, we are hoping to target 15 million and reach 100,000 with one-to-one. We actually want to break that down further. We want to actually be able to review those targets and say, for this 15 million, we're saying 60% has to be adolescent girls and young women, 40% has to be adolescent boys and young men. Of this 60% and 40, or of the 100%, 60% have to be young people that are completely disengaged and feel disgruntled from the whole conversation on HIV and SRH. Just young people who have not, they're not your professional conference goers like some of us are. And then this other 40% would be now the youth networks and the youth-led organizations and the community-based organizations that are working for young people. So really what I'm saying is we are reviewing our targets so that we may be able to say, we may be able to really just highlight exactly the number of young people we want to reach, where we want to reach them. And in-house, we're also working on a monitoring and evaluation toolkit that we may be able to revise every once in a while. I think we mentioned that we'll be doing it every 2 months, just looking at this is what we've done so far, these are the numbers we've reached, and then we can be able to also tell where do we need to concentrate our strengths more. Maybe we're reaching more urban youth than we should be reaching rural youth. So now we concentrate our strengths on rural youth. From that, maybe we can also say we've reached, we've not been able to actually reach most at-risk adolescents. So now we need to shift our attention towards that. So we are reviewing our target, and we are saying that our targets have to have tangible outcomes in the end that we may be able to measure. Then you finally were talking about the fact that you have adolescent TWGs in some counties, and already some are linked to youth advisory councils, and how do we intend to reach out to those existing structures? As I mentioned, for us, it's really collaboration. And again, our team that is working on the advocacy bit is actually, they have a whole spreadsheet that highlights what are some of the existing structures already on the ground, and how do we plug into those structures. So really for us, we are not at all going to come up in the morning or today and wake up and say, now we have a new Maisha Youth TWG. No, we will actually be aligning and plugging into the already existing youth TWGs, and then just now use that platform to amplify the voices of the young people, both in the counties and in the national outlook. Yes, I think I answered, I tied the question by Stella to the question by Felix. The question by Dr. Mochate, I think I'll allow Becky to answer that.
Okay. The question by Dr. Motaze is, do we have plans to rope in communities of adolescents and young people living with HIV? Issues to do with transition from pediatric care to into adult care and viral suppression. We will work with the already existing youth networks that are supporting the young people living with HIV. And it's not only so currently, as I was saying, Maisha Youth is serving as a platform where all these different organizations can come in and work together towards the same goals. We have members who are from Southeast Kika, we have members from Blast, and so I think that for us, it's working with the already existing structures instead of just having to redefine the whole wheel. Why don't we just work with people who have already been doing what we're trying to do, and then sort of pull our strengths together and have reach the same goal? Because I think ultimately the same goal is to reduce the HIV infections among young people and keep the ones who are HIV positive living positively. So working with already existing structures would probably be the best approach for this, which is what we are currently doing. And then there's also a question from Florence. As young people, how do you plan on addressing HIV stigma and discrimination? So I think our approach for reducing stigma and discrimination is basically to raise awareness and advocacy, because we feel that the reason young people are being stigmatized or there's discrimination is because people do not have relevant information. And so there's also, yeah, that's one of the biggest gaps that there is. And so we want to work towards disseminating information that way. And then also online, we have a hashtag Love Me No Different. I don't know whether you guys seen it. It's basically about reducing the stigma and discrimination, which is mainly because people are not well informed. Mainly because people are not well informed, and so by making sure that these young people are informed and then they have the information they need, then they find that having HIV is not does not make you any different. And so for that reason, we feel that that's the best way we can push for that information dissemination and just raising awareness and advocacy. Yeah, I think I've answered that question. Over to you, Rasheed.
We want to thank everyone for who has been able to join into this conversation, and for the awesome comments, questions, and just the engagement that we've had with you all. I think I will hand it back to Kevin from NAC, and to just say asanteni sana. We hope to continue working together in this, and we are ready to invite you all to the table to help us really just define the broader aspect of Maisha Youth, and as we continue to put young people at the center of this response. Thank you all. Thank you, guys.
Wow, thank you very much, Rasheed, Mutaha, and Rebecca Nyankieya, for this absolutely amazing presentation. You guys have really introduced to the participants about what the Maisha Youth movement really is about, and told us how we can join, and you've told us what you've been up to in 2017. You've given us a bit of an outlook into what you'll be up to in 2018. This is absolutely amazing. I can see a couple of comments streaming in, but I believe you pretty much handled all the questions that came in. So thank you very much to both of you, and also thank you to the participants today, and thank you for your comments. We do look forward to having you on more of these webinars and having more of these conversations. So if you're not registered to the Maisha Maarifa Research Hub, kindly go to www.maishamaarifa.or.ke, sign up, and you'll get invitations to our forthcoming webinars. So thank you very much, guys. Keep the comments coming in. I'll keep the window open for a bit, just in case we have any additional last-minute questions. Thank you, and have a good afternoon.